Welcome to the musculoskeletal assessment. In this module we're going to examine the hip and the pelvis. The hip is a diarthrosis, anarthrosis ball and socket, and the SI joints, amphiarthroses, synchondroses, and gliding joints. As always, we start our assessment using the Hippie-Rohn model, history, OPQRSTUV. We want to determine the onset of this hip or pelvis pain. What provokes it? What makes it better? What makes it worse? What is the quality of the pain? Is it dull, sharp, burning, aching, stabbing, crushing? Does the pain radiate from or to another site? And what is the specific site of the pain? What's the timing of the pain? Does it come with activity? Does it come after sleeping all night? And is there an underlying motive for your patient presenting with hip or pelvis pain? It's very important to get vital signs: temp, pulse, respiration, height, weight, blood pressure. And as always, in our differential diagnosis of joint problems, we use the mnemonic rabbit men. Is this referred pain to the hip or pelvis? Is this an arthritis? Is this bone pain? Is this bursa pain? Is this tendinous pain? There are many tendons and ligaments in this area. Pause the presentation and take a moment to review these. Is this muscle pain? The hip and pelvis are insertion points for many of the major muscles in the body. Is this an effusion? Here's a coronal T2 fat saturation MRI showing hyperintense right femoral head and neck with minimal joint effusion, you can see, and subchondral area involvement. Is this nerve pain? Again, using the mnemonic rabbit men helps you to focus on the cause of joint problems. In our inspection, we want to examine the client's gait. Is the gait normal? Is the gait abnormal? We want to look for discolorations in the hip. Is there an obvious deformity? In palpation, we want to palpate the anterior superior iliac spine, the iliac crests, and posteriorly the posterior superior iliac spine and the ischial tuberosities. Our palpation of soft tissue includes the femoral triangle. Take a moment and pause the presentation and review the landmarks, the borders of the femoral triangle. Recall, if you will, that the femoral vein, the femoral artery, and the femoral nerve all run through the femoral triangle. Palpate the gluteus medius, the sciatic nerve. Percussion of this area is not applicable. You want to be alert for any incidental, any fortuitous or chance findings. Here you see chronic pelvic osteomyelitis. Range of motion of the hip and pelvis includes flexion, which is 90 degrees with the knee extended, and 120 degrees with the knee flexed. Extension is 15 degrees. Abduction, 45 degrees. And adduction, 30 degrees. Internal rotation, 40 degrees. And external rotation, 45 degrees. This is a mnemonic to help you remember the specific orthopedic exams for the hip. LATA hip. The L stands for leg length. You'll want to measure the leg length to make sure that it's the same bilaterally. Ober's test tests for hip contractures, tests the tensor fascia lata or the iliotibial band. Pause the presentation and review this slide, and then practice this exam on a partner. The T is Thomas test. The next T is the Trendelenburg test. The A is for the anvil test. The next is Hibbs test. Next is Yeoman's. And finally, Patrick's. The neurological exam for cord levels. Flexion is achieved by the psoas, cord level L2-4. Pause the presentation and examine this slide. Extension is achieved by gluteus maximus through the inferior gluteal nerve S1. Abduction through the gluteus medius, superior gluteal nerve L5. Adduction by adductor longus through L2 to 4. Internal rotation by gluteus medius through L5. and external rotation by piriformis L5. And then examine related areas, including the lumbar spine. Please review this presentation several times so that you can memorize these tests, LATA hip, and the cord levels and the innervations of the lumbosacral nerves. This is the end of the pelvis and hip assessment.